Anthony, thank you. Well, we're continuing our coronavirus coverage this morning, and as Omicron case rates are rising throughout the nation, many people are wondering how to continue to best protect both themselves and their families. And joining us now live to speak more on the topic is public health physician Dr. John Zweifler. And Doctor, thanks so much for joining us bright and early this morning.
Good morning. Glad to be here.
Of course. And hey, new federal testing that's rolling out today. Officially, people were able to enter their address yesterday, kind of get the ball rolling on that. But how important is testing?
Well, it's extremely important because there are other viruses out there that can mimic COVID. It's most important for those of us who are sick. So if you're having any kind of symptoms, get tested. And if you're positive, then you should stay home. So testing really helps us sort out what's COVID from some of the other conditions, as well as if you're in a situation where you may be around others who are at high risk of getting really sick, or if you're, say, around an elderly a parent or grandparent, and you want to make sure that they stay safe as well.
And that kind of ties into just the fact that these cases are rising so fast. Our hospitals either have no or very low bed availability, some facing staffing shortages that can't get their nurses. And that's kind of a way Valley residents maybe can do their part in preventing the spread from continuing.
Yeah, there's other things we can do as well. One of the big ones is just wear a good, well-fitting mask. So there's much more availability now of KN95, and there's a program to distribute N95 masks. So that's a really good first line of defense. The other is, as always, get fully vaccinated. And if you're eligible for boosters, do that. Most people are eligible for a booster now at 5 months. And as we mentioned, if you're sick, stay home and get tested.
Thank you, Doctor. And some studies even saying Omicron, maybe is not as severe. We're not seeing people hit as hard as some of the first variants, patients being released after they're in the hospital. But why then would it still be important to take precautions against Omicron?
Well, there's two reasons. One is that there are individuals who do get really sick and who die from COVID and from Omicron as well. So we want to protect our high-risk, vulnerable population. So it includes the elderly, those with chronic conditions like diabetes, obesity, hypertension. So people do get very sick, end up in the hospital, and die from COVID and Omicron. The other is that it's extremely disruptive to our society, and particularly settings where are crowded indoors, where respiratory viruses tend to spread. So those include our schools and our workplaces, so critical places that we want to keep open. So we need to do our part to ensure that we can continue to function as a society.
And that hits on our next question is, this has been so disruptive, as you mentioned, and we've seen just business and our economy dismantled by this virus. If cases rise, and if we keep seeing the spread, do you think we could ever expect another lockdown, or is this just something we have to learn to manage and live with? It's not going to go away.
Well, I think COVID is probably going to be with us, what we call an endemic disease, and so like the cold or the flu, where it's around. So I think we're moving towards that. I think we're closer to getting back to more sense of normalcy than we are to a lockdown. But we are facing a really difficult couple weeks here. So I really encourage everyone to be patient, do their part, wearing a mask, getting vaccinated, getting boosted when eligible, and stay home if you're sick. If we do those things, we make sure that we test folks when they're sick and they stay home. I think we can learn to live with this and have more of a normal life.
Back to normal. All right, Dr. John Zweifler. Doctor, thanks so much for joining us this morning. We really appreciate your insight.
Yeah, my pleasure.
All right, take care. And hey, it is 6:17 now this morning. Coming up